We were talking about bleeding behind the eye, and that is one of the, I think, probably the most serious complications of diabetes, is when you get this neovascularization, or these blood vessels that grow in response to poorly controlled diabetes, and they bleed, and then you basically now have total blindness because the blood is not, it doesn't clear from that particular part of the eye. And that's why you go and get an eye exam every year when you're a diabetic, to find those particular areas where they can be lasered. And the laser actually fries the blood vessels before they can actually bleed. And that's one of the major reasons you do that. Also, there can be what they call amyloid deposits, which are basically deposits of a gelatinous-like substance in the retina, which can cause sometimes retinal separations and periodic blindness and flashing lights and things of that nature. That's different than a migraine, which basically is scotomata, where you actually get this total body where you actually lose a lot. You see all of these flashing lights, and then you get followed by a headache. So that's a totally different situation with regards to that. So when we talk about controlling our blood sugars, what the retina and the eye is what they call part of the microvascular system. It is part of the small blood vessel system, and as opposed to what is termed the macrovascular system, which is the large vascular system. So we're going to interrupt that thought for just a minute while we talk to Louis. Louis.
Hey, Doc, how you doing
Good.
tonight?
How are you?
I'm doing fine. Listen, I've got a question.
Mm-hmm.
How dangerous is stress on the body? Because, you know, we all go through stress and stuff, and sometimes people hold it in, sometimes people release it. How dangerous is it to our body, and how do we release it? That's my question. Thanks.
Okay. Yeah, very good topic. So we'll interrupt the diabetes thing just to talk a little bit about stress. So it comes in lots of different flavors, just like ice cream. And we can have the kind of stress that we induce on ourselves, physical stress, such as working hard and things of that nature. Those are actually probably good things as long as it's in a somewhat controlled environment. But when people get stressed out, their blood pressure will go up. And they will secrete adrenaline. They also will suppress cortisol production. They'll alter their adrenal, their hormonal balance in their body. They may eat more. They may, sedentary more. They may worry more. They may sweat more. They may do increase in heart rates and things of that nature. So if you have an underlying medical condition, such as maybe diabetes or some high blood pressure or some underlying condition, certainly stress, being uptight, angry, frustrated, things of that nature will, when you internalize it, is going to make those problems that much worse. How much worse? It's an individual thing. It's very hard to say. But you have to be able to identify that you are indeed in a stressful situation. Now, in a true, very, very intense stressful situation, such as being in a gunfight, or being pulled over by a police officer, or being chased by somebody, you can feel the effects of a tremendous amount of adrenaline. You get tunnel vision, blood flow. It's the fight or flight reaction, and those are very short-lived situations, and they basically they go away as quickly as the stressor goes away. There was once a study, and I read about it, where they did a study on young men that were in combat situations, and how much atherosclerotic cardiovascular disease they were developing in their abdominal aorta because of the stress, meaning they basically had this, their aortas look like that of a 60 or 70-year-old man, because their diets were high in fat and they were under a tremendous amount of stress all the time, and that indeed causes atherosclerosis and a lot of the problems. And on top of that, probably the smoking that they did, the unhealthy lifestyle, the drinking, and all the other things on that, and then add in a little bit of combat stress and bullets flying over your head, and it's a very, very intense situation in that respect. So once the stress has caused an anginal situation or your blood vessels too decrepit, it doesn't repair itself. In fact, it becomes very additive. And once you've gotten into that situation, you cannot undo it. So the key is to never let yourself get in that situation, but that's a lot easier said than done. Can anxiety, there are people that have true anxiety, meaning they're just very anxious. They feel like someone's out to get them, the walls are crawling in. And this is a deficiency in a neurotransmitter called GABA, GABA. And when you have a deficiency in GABA, you just can't explain why you're stressed all the time. You just know that you are. You feel like your throat has got a lump in it. Your heart's racing. You feel like there's impending doom and those types of things. And then that situation can be helped with a drug like Valium or those drugs. It basically helps to eliminate the GABA deficiency. So those people, when they take 10 milligrams of Valium or 5 twice a day, they actually are normal because they've actually restored the imbalance in the system. Can you say that the imbalance in the system lasts forever? For some people, there can be situational anxiety, situational depression. They get a divorce, they get a separation, loss of a loved one, a recent move. Those things are very stress-inducing, but they usually can be resolved. Sometimes they're not. Sometimes in a delayed grieving situation, a person can die and the person cannot, a loved one can pass on, and they don't go through the resolution, and 6 months later they're still grieving over that person. Delayed grieving reaction can lead to long-term depression, and there's a whole host of diseases, cancer, heart disease, stroke. All those things are higher, much higher in individuals who have unresolved grief and loss, as well as anxiety and things of that nature. It interferes with your sleep. If you don't sleep, your mind doesn't rest. If your mind doesn't rest, it can't remember. So it's very important that if you feel those situations coming on, get in to talk to your healthcare provider. Let them listen to your symptoms. Have them analyze. Hopefully your healthcare provider takes the time to analyze your personal life, and then getting some counseling may be able to help someone independent to listen to you, to roll those things off. It doesn't have to solve the problem. You just have to be able to do that. And a lot of times women are so much better at that than men. I mean, women can sit around and talk and listen, and they don't have to solve problems. The difference between men and women is that man has to solve a problem. I mean, he's a caveman. He's going to fix it. He comes out, fixes it, and goes back to his cave. That's just what we do as men. Ask me a question, I'll tell you how to solve it, and then build a watch. Or, who knows? I mean, the point being is that men tend to make things more complicated than they really are, and women are more into feeling and emotional things and letting things run off of them, and they go on down the road. Part of the reason maybe they live a little longer than we do, because they don't internalize the stress. So you have to figure out that that's what it is, and then you have to basically find someone that you can talk to. If you go into a room and you stew over it and you don't get a resolution, then you're going to internalize it, and then it's going to come out. It's going to come out somewhere. Somewhere aspect of your life, it will show up. It's like a boil. It's like an abscess. It may be dormant, but sooner or later it's going to show up somewhere, and where it does, who knows, and what the consequences are, could be helpful. So hope that helps your question. Stress is very dangerous. Get in touch with it if you feel like you're having those issues and you're not functioning well, and then you can get some professional help if you need to. Okay, back to diabetes and the effect on the eye. We were talking about microvascular as well as macrovascular issues. Macrovascular being your big blood vessels, and microvascular being your small blood vessels. The small blood vessels are nerves in your nervous system, in your kidneys, as well as in your eyes. So in order to prevent the microvascular complications of diabetes, your average blood sugar should be around 6.0. That's where the studies tend to show that you prevent neovascularization of the eye, and you prevent kidney disruption, and you help to preserve the small blood vessels in your nerves. However, the studies also tend to show that in order to prevent macrovascular or heart attacks or strokes, that your average blood sugar needs to be around 7. So what we find is that if you try to get tighter control at 6, you actually create a situation where you have more macrovascular events, meaning low blood sugar causes increased adrenaline. And so people will have low blood sugars and they'll say, oh, they feel shaky and they feel, they perspire, they may get things of that nature. I mean, these sympathetic discharges of our nervous system basically put a lot of strain and tightening and tugging on the blood vessels, and this in turn can cause heart attacks. So what I would suggest is that average blood sugar of 6.5 to 7 to 7.2, because the older you get, you want to creep up towards that 7 range, and the younger you are, you want to stay closer to the 6 range. I mean, I'm not worried of someone having a heart attack necessarily in the 40s unless they have some other risk factors, but I am worried about someone in the 70s having a heart attack by trying to control his blood pressure too much, as well as the risk of falls and other problems like that, meaning you don't increase your longevity or your ability to live longer by having tighter control. When you're older, you actually shorten your lifespan and you actually put yourself at more risk for problems. Most of the heart attacks occur in the 6 o'clock, range. So let's think about it. You got a low blood sugar because you took a diabetic medication at night. Now you have a circadian rhythm bump in your blood pressure at 4 to 6 a.m. in the morning. On top of a low blood sugar, now you're going to get a really stressful situation while you're sleeping. And if you have an atheromatous plaque that is ripe for rupturing, it could do so, and in turn causing a clotting cascade, and therefore you would have a heart attack if there is enough blockage in that artery. So that's how you get those nighttime events that cause that. So with regards to the eye, it's important to have your blood sugar at that 6.5, and it's important for you to really see the eye doctor once a year. That's the current standard of care. They look in your eye, they do a retinal mapping, and they look and make sure that you don't need additional procedures. So we'll be right back. We're going to take a break, and we'll talk a little bit more about diabetes in the eye. Thank you.